Well, I didn't know I had a glaucoma. I did not know that. It's a sort of a silent disease until you really start to have, problems with your vision, and it can rob you with your eyesight.
Late in the disease, you've lost a great deal of vision, and you can no longer see well enough to find words on a page. You might not be able to find something that you've put down on a counter.
Well, the problem is that it's irreversible. So glaucoma is said to be the second leading cause of blindness in the world. It's actually the leading cause of irreversible blindness.
So without treatment, yes, many people go blind from glaucoma. But with treatment, we're usually able to prevent that outcome and keep the patient seeing for a long, long time, usually their entire life.
And with this, glaucoma presents us with something of a medical riddle. How can we save our vision from a disease which does its damage before we even know it's there? The answer comes down to your eye doctor and his or her ability to diagnose glaucoma as early as possible. That ability has been significantly improved over the past 2 decades, thanks to a technology called optical coherence tomography, or OCT.
OCT is an imaging technique that allows us to look into the back of the eye and see the cellular layers of the retina in exquisite detail.
That detail matters tremendously because at the back of our eye, there are tiny nerves that give us our ability to see. Those nerves are spread throughout something called the nerve fiber layer. Glaucoma causes those nerves to die off, and when that happens, the nerve fiber actually grows thinner. That thinning is a very early sign of glaucoma, and one that used to be extremely difficult for eye doctors to see.
Prior to OCT, you have a certain amount of certainty that a person has disease or doesn't, or is getting worse or isn't.
But it was very qualitative. And you could say, yes, it's normal, it looks a little thin, or it's not there at all. And that's about as good as it got.
With the use of OCT, that level of certainty is multiplied.
We really can get a very firm handle on what the thickness of the nerve fiber layer is.
A very powerful example of what this has meant to the diagnosis and treatment of glaucoma can be found in one of Dr. Schumann's cases.
A little over 30 years ago, I saw several ophthalmologists and was given the diagnosis of pigmentary glaucoma.
Dr. Webster, a vascular surgeon, lived with this diagnosis for many years. It was during those years that OCT was developed. And so when he visited Dr. Schumann for an update on his condition, Dr. Webster received a welcome surprise.
I was able to measure his nerve fiber layer, and I found that, in fact, that he didn't have glaucoma. That was 13 years ago. And to this day, he has not progressed. I don't fault anyone for treating the patient, because I probably would have too if I didn't have the additional information that OCT gave me, which was that he had a healthy nerve fiber layer.
But other patients that eye doctors monitor do develop glaucoma. And in these cases, OCT's ability to find the disease early is unmatched. Charlotte Matthews is one such patient that Dr. Schumann was following.
The deterioration in my eye wasn't showing on some of the other tests until I had the OCT, and then that's where the deterioration was starting to show.
Because we could measure a change with the OCT, we were able to cinch the diagnosis of glaucoma in this patient. I can't think of a patient in whom we could actually catch the disease earlier than this.
Having caught it early, that means to me that, that it's going to prevent, further damage to my eyesight, to my retina. I'm relieved. I just know that I'm under good care. So, if I continue what I'm supposed to be doing, I'll be okay.